Hello, welcome to the Stories That Sparkle podcast. I'm Hella Rader. I'm in my New York studio situation here. So, yeah, fun times, creative on the go. Just wanted to let you know that this is available as a video podcast episode on my Substack, hellarater.substack.com. You can, of course, listen audio only wherever you get your podcasts. I am still working out the technical whatchahickers around getting the video to populate in Spotify, Apple Podcasts, all of that. So in the meantime, you can certainly watch on my Substack, hellarater.substack.com. So having gotten that out of the way, just want to introduce briefly my guest for today, Dr. Lillian Medhus. She is a women's health practitioner and she is a certified menopause practitioner. So, yeah. She is incredible. She's located in the Dallas area. I was introduced or found her, came across her via Mandy Dixon via Instagram at ADHD Menopause Therapist, by the way. That's Mandy Dixon. Anyway, as a result, I almost connected with Lillian when I was out in Dallas last September during the Disco Ball tour, but unfortunately it didn't work out because she was opening up, in the middle of opening up her now fully operational women's health clinic. What? Yeah, so I'm really excited to be able to sit down and chat with her via Zoom and have a whole conversation about both her personal journey with her own health issues and what brought her into becoming a nurse practitioner and a certified menopause practitioner and just specializing in endometriosis and pelvic pain and complex gynecologic issues. So, yeah. This woman is on top of it, and it's born out of her personal journey. And yeah, so we cover a lot of ground in here. We have some great info, great tips, great pointers, ways to find good help and care, and yeah, just things to look out for and ways to gauge where you might be at in this journey and what you might need to communicate to your doctor if you're not being asked the questions you feel are important. So lots in here, but the biggest takeaway for me is that yes, pain is not required. And as someone who lived with a lot of shame around my pelvic pain, painful periods, painful sex, like I didn't talk about it, not with my friends, not with my doctors, I really felt great solace talking to Lillian, both in our shared journey with some of that and also in how that informs her approach to giving care now to other women. So yeah, it's a really wonderful conversation, and yeah, pain is just not required. It's just not. We do not need to suffer. So there is help available for our bodies and our health. So anyway, there's a lot in here for y'all, and I hope it's helpful. And if you're enjoying the Stories That Sparkle podcast, if you want to get the word out and help support what I'm doing here and building this platform to get bigger and wider and taller and stronger and more, please pass it on to 2 friends. Let them know about it, and please become a subscriber to my Substack, hellarater.substack.com. Yeah, that's right. And now, without further ado, I invite you to get comfortable, sit back, and listen in, or watch along. Hi, Lillian. Nice to see you.
Nice to see you too.
Well, thank you for joining me.
Sure.
I was really sad that we couldn't connect in person when I was out yonder in Texas for a few days.
Yeah.
But you were in the middle of starting up the clinic or opening what is the current incarnation of the clinic, right?
Yes. Yeah. I was subleasing a small space before and was I think like that week was moving into my new clinic.
Right. Yeah, there were lots of moving parts. I remember that. So.
Yeah.
Well, we met virtually through Mandy Dixon.
Yeah.
So she's just lovely. So So I was really, I've been doing a bit of a series on women's health, specifically midlife women's health, which obviously perimenopause, many menopause, also the ADHD component. But I
Hmm.
really wanted to chat with you because I know that you've been on a journey with how you practice medicine and how you give care.
I went to nursing school knowing I wanted to be a women's health NP, so that was kind of always the goal. And I ended up getting a dual degree as a women's health NP and a midwife. And spent the first couple of years of practice, about 4 years, practicing as both. So I was attending births and doing, pregnancy care and postpartum. And through that, it was really beautiful experiences, and also found it wasn't the right fit for me. It was really hard on my body. I was doing, 24-hour call shifts and then having to stay up to attend to other things during the day. And my health just kind of started to take the toll. And at the same time, I knew I really liked gynecology. So I like to find the problem, figure out the solution, and fix the problem. I like pathology. I like these things that are complicated that a lot of other people don't really want to deal with in a 15-minute type visit. Um, so I left midwifery and I started practicing at a VA actually in complex gyn.
Oh,
And
wow.
yeah, yeah. So I did that for about 4 years in Dallas, and worked with a lot of wonderful female veterans. Saw a lot of chronic pelvic pain and endometriosis. Did some menopause management, sexual dysfunction, abnormal uterine bleeding, just a lot of those types of things. And it was actually during that time that I started to recognize that, man, all these endo patients that I'm seeing look a lot like me.
Oh,
Um,
yeah. Hmm.
so a lot of times people ask me, did you get into endo and pelvic pain because of your own journey? And actually, no. It was caring for those people that made me recognize that I needed to stop kind of gaslighting my own self and get treatment as well.
Wow,
Um,
that's really Yeah, it's interesting because I mean, I had endo and had no idea.
mhm,
I don't
mhm,
know if it's because I didn't talk about the true nature of the pain I was in. Was
mhm,
probably part of it, or if my doctors just didn't think, at the
mhm.
time, didn't think to connect those dots. But yeah, I just suffered. I thought that was
Yeah,
just how it. I was like, well, I guess it's just this is how it is. It's just
yeah,
painful all the time. Yeah.
yeah, yeah, yeah. And that's most people's experience, unfortunately, until it kind of reaches a like fever pitch where you just can't ignore it anymore.
Yeah. Yeah. So in that working in the VA, was it a hospital or a clinic or
Yeah,
yeah.
it was a clinic within the hospital.
Right, right. So after that, what was the so you get onto your own endo journey or discover like, this sounds familiar. I may want to look into this for myself. And so
Yeah.
is that what then took you into a new direction?
Yeah. So during that time, I had a lot of health issues, include endo, but also thyroid cancer and a few autoimmune diagnoses. And so I decided, I really need some time to work on my own health, figure this out. I wasn't really finding like the holistic functional approaches that I was looking for. And so I kind of put it together myself. I found my dietitian, I found a pelvic floor therapist, I was getting, mental health support. And through this journey of kind of healing myself and finding that I could feel good and not be in pain all the time, those providers that I was working with encouraged me, hey, you know how to do this. You should start a practice and do this for other people.
Wow. So I'm hearing already like community has been a running theme in every conversation I've had, no matter what it's been about or what story is being shared. So every woman in some form or fashion has brought up community. So I'm already hearing right there this community of other doctors or practitioners who are encouraging you to take the leap of faith and go out there and do your own practice.
Yeah, 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 yeah. They were integral to it. I even where I used to have my small clinic when I was subleasing was one of those practitioners that I had worked with because they were just said they believed in me and they wanted to see this come to be.
Right. Wow. Yeah, that's incredible. I've had my own versions of that over the last couple of years, starting over where, somebody was willing to say the thing, of encouragement or like, no, you can actually do that. And I'm like, what? I can?
Yeah,
And they're like, yeah. And I'm like, oh, well, if you believe in me, then I might be willing to believe in myself, start as a starting point until I
yeah,
can get there. Yeah.
yeah,
Yeah.
yeah.
Wow. So, once you started your own clinic, what was some of the challenges of getting that up and running?
Yeah. I think the biggest challenge, like you were saying, is just believing that you can do something. Because we're taught how to, practice, as an NP, practice women's health, but not how to run a business. And so a lot of it is just kind of the stories in your head of like, I can't figure out the finances. I can't figure out this complicated thing. So just, being able to have people around me and be able to say to myself, no, you can figure out, complex things. You can figure this out too.
Yeah, I've recently been running into my version has been a resistance to doing the admin stuff or like
Yeah.
like what to me feels hard in terms of submitting my work or
Hmm.
putting myself out there in that kind of way because then I could get rejected and
Hmm.
all of that. I'm like, yeah, well, if you don't, you're definitely getting a no. So you might as well try and see if you might get a yes.
Yeah.
But I have found that really hard recently to like that resistance in me to doing the boring stuff
Yeah.
that I
Yeah.
don't feel I'm as good at. I'm like, I'm not as good at that. I don't want to
Yeah.
do that stuff. Yeah. Yeah.
Yeah. Yeah.
So what has it been like since you opened the new space? What was that like? Was that exciting or?
Yeah. Exciting, scary. I started the practice just over a year ago. Wasn't sure if we would get any patients, to be completely honest. I practicing in the VA was a completely different system, so I didn't have a lot of like community referrals and that kind of thing. But it's grown very quickly. We've gotten to serve, a couple hundred women in the past year and just continues to grow. And so I think having that space, even though I do a lot of telehealth, just kind of tells people like, hey, we're here. We want to be rooted in this community. We want to serve the people in this community. And that extends, throughout Texas with telehealth, thankfully. But I do think that the physical space kind of is something that women can say, okay, like I'm tied to that.
Right, right. So it sounds again like you're building a form of community for them, even if it's just with you to like come to your space and spend time with you to hash out their medical issues. So,
Yeah,
yeah.
yeah, yeah.
So what's the one thing you see the most that you're just like, oh man, I can't believe we're still missing this or people aren't, like I don't know, like because I know that that's been a huge one, the medical gaslighting that I've experienced personally. And so, the things that are getting missed, specifically women's health. What's the biggest thing you think for you that you're seeing?
Well, I think thank goodness for social media. I think perimenopause is not getting missed as much as it used to, because women are recognizing it, right? They're getting educated. But for me, I think it's the connections of like the current system has so many holes. And so if you're going to one person for your uterus and you're going to someone else for your heart and you're going to someone else for this, who's the person that's putting it all together? And that's what I see with a lot of my chronic pain patients, endometriosis and, POTS and MCAS and neurodivergence. Like, no one is saying, wait a second, this is all connected. It's not a whole bunch of disparate things that are going on.
Right. So, what's your process when someone comes to you as a new patient? Like, what's your intake process like? Or, in general, like, how do you work that's, not new, but different and more holistic? Like, how does that approach look for you?
Yeah. Well, they fill out a lot of paperwork. Sometimes they tell me too much. But that helps me to get to know people before I even see them. So I kind of can start to put a picture together of, okay, man, they've been to 5 different places and haven't really gotten this addressed. This is what's happened so far. So they do a lot of intake paperwork. I spend time going through that before the visit. Then we spend about an hour and a half in the first visit talking. Sometimes there's a physical exam if it's necessary, but mostly we're just talking and we're trying to put together, okay, so you've had, I don't know, vaginal dryness for this many years, and you've had brain fog for this many years, and then, your periods have been painful since you were 12, and no one has really addressed that, and so we're trying to like put all of those pieces together. Then we get a big, extensive lab panel to look and say, okay, what else might be going on? Do we have nutrient deficiencies? Do we have gut health issues? Do we have insulin resistance? Are there other things that are driving the reason why you ended up in my office? And then we come back like 2 weeks later and go through all of that together and start to build out a plan that addresses all of it rather than me saying, oh, you know what, I'll give you your HRT, but I'm not going to address X, Y, and Z other things.
Right, right. Yeah, because I mean, you operate as a kind of like whatever they're calling concierge
Hmm.
type of medical clinic, right? Where it's like outside of the insurance system so that you can take more than 15 minutes,
Hmm.
which I know is an unfortunate side effect of the current the mainstream medical system in that regard of, they're on a clock.
Yeah,
So I
yeah.
love hearing that you can spend that kind of time
Hmm.
and give
Hmm.
that kind of time.
Yeah,
So,
yeah,
mhm.
yeah. Yeah, I tell people, it's unfortunate and it's not for lack of wanting everyone to have access, right? And unfortunately, insurance limits not only the time, but they also limit the diagnoses that they cover. They limit the labs that you can have done, the medications that can be ordered. And when you have to go back 6, 7, 8 times to try and get something addressed, you're paying your copays every time. It sometimes is more efficient to just have one really long visit.
Right. No, I think that's beautiful. Um, so I guess my next question specifically to the endo, because so just basing it off of my personal experience,
Mhm.
I was what in my 20s, 30s, well, pretty much forever had just all this intense pain, especially during intercourse, was just painful. Turns out I also had ginormous fibroids
Mm.
I mean, some of this was my lack of connection to my own self and my own body. So I didn't want to know, didn't ask questions, didn't talk
Mhm.
about it. Um, but so that was the other component for me was I would go see my doctor regularly every year and get my exam and all the things, but I never once mentioned the pain I was in. So I don't even know what my question in there really is, but how how is there a step before all of that even for you with working with people and helping them even be able to say when they're filling out the forms the truth of like really what's all that's going on with them because there's a lot of shame
Yeah,
for some people. Yeah.
yeah, yeah. Yeah, I think in my current practice, people that end up with me have usually tried 4 or 5 other things first, right? And so when they get to me, most of them are like, I will do whatever it takes. I will do anything, to fix the symptoms that I'm having. But it does require a lot of self-advocacy before you get to that point, of being able to say, hey, I shouldn't be in pain every day, or I shouldn't, have debilitating hot flashes that keep me out of work or unable to sleep. And so I think to that extent, social media can be a good thing. That's why I'm active on social media, and I appreciate that other people are too, because I do think that hearing the message over and over, you don't have to suffer, this isn't normal, hopefully is bringing more women into our offices and, bringing things up that maybe they wouldn't have a few years ago.
Yeah, because I definitely would say, like, after a lifetime of like, well, I just suffer. That's just what I do. And I know how to do that. It was really hard to admit, like, yeah, but this is too much.
Mhm.
I'm really
Mhm.
grateful I had women in my life, like in my community, that were like, don't suffer, go get help immediately, when they
Mhm.
heard about the hot flashes, especially. So,
Mhm.
yeah, it's interesting because I had ended up getting a hysterectomy way before I hit menopause, or that might have accelerated things probably. And that's when I actually discovered that I had endometriosis, was during that surgery. They were like, "Whoa, there's a lot going on in this lady's body," and I was like, "Oh, I had no idea." So it was, ever since, I've been on a bit of a mission about that.
Mhm. Mhm.
Just, yeah, don't suffer and talk about it, which is uncomfortable
Yeah.
sometimes.
Yeah.
Still, hmm.
Yeah. Yeah. And then if you're met with like the message that that is normal, then I think you're even less likely to bring it up again.
Yeah, yeah. Um, so what would be some, like, what's to the lady listening out there who's like, oh, I feel completely alone in this. There's no one who's going to listen to me, like you just
Mhm.
said. What is like a good place that you would suggest they start?
Yeah. Collecting your own data so you have something to show, right? So if you are trying to navigate the conventional medical system where you maybe get 5 to 10 minutes, they're moving quick, right? So unfortunately, sometimes we have to speak their language, which means quick data spelled out for them. So there's like there's a menopause questionnaire that you can track your symptoms for a week or two and bring that in and show them, hey, this is how significant they are. This is impacting my life. There's an endometriosis symptom screener that I use with my patients. Patients can fill it out themselves if they think they might have endo and bring that in. There's different symptom trackers. You can track how often you're having your symptoms and how they're affecting your life, your work. I find that unfortunately, a lot of times, like the red flag thing that you can say about symptoms is this is affecting my work or this is affecting my ability to do my daily tasks. Oftentimes that will make people stop and look deeper.
Hmm. Right. So it has to get bad enough. I mean, I know that was that was true for me. I'm like, okay, I actually had a stomach that was sticking out. Then I'm like, that doesn't look right. So it took that to finally go to the doctor and be like, I think there's something wrong here.
Mhm. Mhm.
Um, so yeah. So and in terms of menopause, perimenopause, like what are some uh before you have your official piece of paper, like what are some steps that you recommend for women to take, and then once they have that diagnosis,
Mhm.
just general, I mean, obviously each person's going to be different,
Mhm.
what they may need, but what are some high level suggestions you would have?
Yeah. Know what your cycles are normally like. one of the first signs of perimenopause is very slight changes, like starting a day earlier or lasting a day longer. So have an idea of what your periods were like, especially in your 20s. Usually it's, by your mid 30s, things are usually starting to shift already. So have an idea of what's normal for you so you notice when things start to change. And then just kind of, being aware of how your body feels. Are you sleeping as well as you always have? Do you have the energy that you need to do the things that you need to do? Have you started to notice a little more urinary leaking? You leak when you cough, laugh, sneeze, or you feel like you have to run to the bathroom all the time, and you're feeling some, vaginal dryness that wasn't there before. A lot of times it's those kind of slight changes that cue you that, okay, this might be starting to come down the pike for me.
Hmm. Okay, so I somehow did not know that the leaky urinal, the whatever, is
Mhm.
part of it. I did not know that. I just
Yeah.
learned something new today. Thank you. I'm like, wait, what? That was a symptom? I mean, that's what I'm saying. It's just like, I remember the first time I heard that, like a frozen shoulder or a locked
Mhm.
shoulder can also be a symptom of menopause. I was like, what? I
Yeah.
mean, what the hell's going, I mean, because I've had that. I mean, I know some of that's been emotional holding, but then I'm like, when it got just felt permanent, I'm like, oh, this is actually part of my menopause. I can't even believe it. Yeah, that
Mhm.
was shocking. So.
Yeah. 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 My patients sometimes are like, no, don't tell me anymore when I start telling them symptoms to watch for.
Like, no, I don't want to hear that. Please don't say that. Yeah. Yeah. No, it's both a relief I find to be like, oh, well, that explains this. And then the separately, like others a grief of like, oh, I guess that means now I'm that lady who's
Hmm.
in
Hmm.
that part of her life. So
Yeah. Yeah.
yeah, so I that's another, I guess, piece of this for me is, navigating the mental health component, not just the neurodivergence, which is also a big piece. But just also the emotional, like the grief that can come
Mhm.
up and with this kind of big change in life or any of these chronic health issues, really. I mean, there's a lot of powerlessness there. So,
Yeah. 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 Yeah, I find, and it's so intertwined, right? Because sex hormones are brain chemicals. And so, even trying to untwist, like, is this depressive episode because you're going through menopause emotionally, or is it because your hormone levels have declined and we need to replace the hormones before we can see clearly, what your emotional state is doing? So it's very challenging for women to walk through that.
yeah, I know. I'm just thinking back, like, again, like I think about my mom.
Mm-hmm.
Back in the whatevers 80s going through
Mm-hmm.
menopause, clearly unsupported. Like
Mm-hmm.
now looking back, at the time I was like, what's wrong with what's wrong with this lady? She's totally like gone sideways. And now I'm like, oh, that was probably menopause and there was no support and she wasn't talking about it at all. I mean, I
Yeah.
could just feel that. Yeah. I mean, of course she's not going to talk about it with me necessarily, but
Mm-hmm.
I just remember going, what's wrong with what's going on here? Something ain't
Yeah.
right. Hmm.
Yeah. 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 Yeah, and then, I think too in this like wellness culture that we find ourselves in, there's kind of a um, belief that we can out wellness everything. And so a lot of people come to me and they're on 25 supplements and they've done all the elimination diets and they're, working harder than anyone should ever have to work. And it's still catching up to them, right? And sometimes it's we have to say, okay, we're going to set all of this aside and we're going to just kind of try to sit in it instead of trying to outrun the symptoms.
Mm. Oh, that's interesting. So yeah, so do you find that that's, when you, because I mean, I was going to ask, like, there's but both the good about all this holistic overlapping with conventional medicine, and then other elements that would people would consider, out there, which actually some of it's really not. It's very scientific, I know that, but is more considering the whole person, like you were talking about, like not just the mental or the hormonal, but the combination of those things, etc. But yeah, so when you like, so do you start by just saying like, okay, let's stop everything and start like, where is this baseline for you,
Mhm.
for the patient?
Yeah, it depends on, how they come in, but a lot of times for the patients that come in having tried everything, we do have to say, okay, we just gotta, step back. Let's, put aside the supplements. Let's just try to see like where are you at? What's going on? Because all of those things, can be good in small amounts. And I think they also can drive anxiety when you are like, well, I'm doing all of this and it's not getting better, and now I need to work harder and harder. Instead of being able to kind of like sit and say, okay, what's really going on, and what are the couple of things that I can tweak to see improvement?
Hmm. Yeah, that's actually, it's funny you say that because when I when I first went to my doctor, my mentor was like, go to the doctor and get something. I'm like, what is she even talking about? I remember, we did all the blood tests, and because I hadn't had a period by that point in 4 years anyway, because of the hysterectomy, we didn't really have that to go on. But we did a couple of rounds of testing, and he was like, listen, because I'm like, can I take like black cohosh or whatever? And he's like, listen, lady, for you, there's no amount of black cohosh that will touch this thing. Like you're gonna have night sweats no matter what if you take all the black cohosh in the world. And I was like, all right, because I too felt this like pressure to do this naturally, whatever that means, and not. And I had real resistance to HRT because of all the stories around HRT. So I had to do some my own research into it. But yeah. So do you find that that's also a component? The HRT had been given such a bad name, and
Yeah.
yeah, yeah.
Yeah, for sure. Yeah. I think it's again, like the tide is shifting a bit with all of the education and stuff, but it's still probably 50-50. Even the patients that end up with me who, they've done their research, they found me of being afraid of using hormone replacement versus the other half are like, no, start me on it today. I'm not leaving your office without some estrogen.
Right. Immediately, yeah.
Yeah. And I
So
should say
someone,
too,
oh, go ahead. Yeah.
I was just going to say, and some of that even I can speak for myself. Like, in addition to endo, I had really bad PMDD, like premenstrual dysphoric disorder for 15 or 20 years, and was so resistant to going on any form of hormones, even though I was doling them out every day.
Wow, that's so fascinating.
Yeah.
Yeah. Well, I
Um,
think, it's like I said, like resistance seems to be the up in the at the moment in me, like about something completely unrelated. So I find that interesting that it was a real resistance. Like, what do you think that was about? Like, I'm just curious.
yeah, I think it was a combination of like one, my pain's not as bad as theirs. They need it, I don't need it. I can deal with it. And a fear of like there's consequences whenever we mess with people's hormones. Some are good and some are not good. And so I was worried that it would affect my mental health more. And never been better since the day I
Right.
decided finally.
Yeah, I was speaking with someone else in the UK. She specializes in or focuses, I would say, on the ADHD, menopause, perimenopause connection medically,
Mhm,
and hormones, and so and she's a big proponent of the progesterone connection point there
mhm,
in terms of the mood.
mhm,
Like stabilizing elements of that, which I also had not known, like did not
mhm,
fully understand the importance
mhm,
of progesterone. Her point was, it's not just it's more important in some ways, depending on each person, of
Mhm.
course, than
Mhm.
the estrogen itself. Like
Yeah.
that's a whole other ball game. But the progesterone is actually really important.
Yeah.
So I was like, oh, what?
Yeah.
I didn't know that.
Yeah.
Um,
Yeah. Yeah, and that's what starts declining usually a lot sooner. So a lot of my patients that come in at 35 to 40, they're like, is this just being a mom? Is this just how it is to have little kids and to have the mental load and the stress? And yeah, it is. And a lot of times that's when your progesterone starts to decline. So let's see if we can get you sleeping better. Let's see if we can get your anxiety turned down a notch. And then does the other stuff become more manageable?
oh, right. Yeah, it's interesting because now I look back at my 30s and I'm like, oh, if I had, who knows how much of that was just
Right.
this, my
Hmm.
progesterone levels. And I had
Yeah.
no idea, no one even thought to, again, I don't know that when I went to doctors, I was very forthright and comprehensive in talking about what was really going on any level. So there was that. Like, so it was a combination. Like, I had to get over my own shame and secret keeping
Hmm.
about anything to do with the body,
Hmm.
and then find doctors or medical practitioners who could help me once I was
Hmm.
willing to talk about it. Yeah. Who knew what to do, because
Yeah.
so
Yeah.
many of them don't.
Yeah. Yeah. And I want to say to you too, like, yes, and that's our job. Like, we should have been
Mm,
asking you. We should have been saying, many women in their 30s feel like this. Are you experiencing that? And that's on us too.
all right, I received that. I'll take it. I'll take it. So, what would be some ways to treat endo? Because I'm like, I don't know because I wasn't properly diagnosed at the
Um,
time. So, I'd never had to look at options, but I'm just curious, like, what are some ways that it can be treated aside from just pain management?
Yeah, yeah. So I always tell my patients we look at this in these tiers, right? And so for people that don't know, endometriosis is a chronic inflammatory condition. It affects your whole body, your whole life. It does not end at menopause. And it has cells similar to the lining of the uterus that are outside the uterus. It can be anywhere in the pelvis, the diaphragm, even further. So we're looking at this in tiers, right? So one tier is the endo itself. So at the right time, getting in the patient with an expert excision specialist who's going to get all the disease out. That is one tier. I work with a lot of patients pre and post op and work with some surgeons in Dallas. But then we have all these other tiers because unfortunately surgery is not a cure. So then we're looking at, okay, how do we manage the hormonal effects of endometriosis using different, progesterone, progestins, other options that we have on the table? How do we decrease inflammation that to turn down the endo pain? So then we're looking at things like microdosing GLP-1s for some people. We're looking at low dose naltrexone. We're also looking at sleep and stress and anti-inflammatory diet. We have a supplement regimen that we use a lot. And then we're looking at, okay, in the labs, are there nutrient deficiencies? Is there insulin resistance? Is there signs that there's other autoimmune conditions? Do we need to get you into physical therapy because there's hypermobility and, tense pelvic floor muscle components? What about, the mental health component? There's something called um, catastrophizing. I don't love the term, but basically, it can be when you're in chronic pain, you start to think it's always going to be like this, it's never going to get better. And that actually physically increases the pain. So we have to get some people on board that can help us to change our thinking patterns around chronic pain too. So it's addressing all these different components and then looking at all the other diagnoses that can be attached to endo too.
Hmm. Wow, thank you. I don't know that I've ever asked anyone that question and gotten such a great like breakdown of all the different ways that endo shows up and what it affects and how it needs to be. It's a more complicated treatment than just like one thing.
Yeah, yeah.
Yeah.
Oh, I could talk about that all day, so I have to cut myself off.
No, I think it's great. I mean, I think it's still one of, to me, one of as much as people are talking about menopause a lot more, I still find that endo is not something because it's somehow, I don't
Yeah.
know, even more taboo. I don't know why, but it just seems to me that way, at least from what I can tell. Like, I think it's starting to happen. I'm noticing it's starting to happen where it's being
Yeah.
talked about more out there in the world, but it's still, I think, behind, at least from my perception,
Mm-hmm.
behind where menopause even is.
Yeah.
So, yeah.
Yeah, for sure. Yeah.
Hmm.
Yeah. And I think it's because it goes undiagnosed so long, it's just really misunderstood by the general medical community.
Right, right. Yeah, and I just think there's this, for me, like again, personally, it was this connection between the shame of like, well, if sex is painful, there's something wrong with me.
Yeah.
Like I'm just broken. Like I can't be, I'm unfixable. So
Hmm.
I'm just going to suffer this way. And actually, that just makes it worse,
Yeah.
obviously, and makes it even more difficult to have, pleasure. It's
Hmm.
just impossible at that point. It's like now it's like, no, thank you. I'd
Yeah.
rather
Yeah.
not. Yeah.
Yeah. Yeah. Yeah. Yeah. I've seen it for myself that endo affects work, it affects relationships, and I think that is all another grief that a lot of women don't talk about.
Mm-hmm. Right. Right. Yeah. I'm really like, this has brought up a lot of the grief component and the losses of
Mhm.
different things that, um, go also unattended, and can really fester and manifest physically, of course,
Mhm.
and add to the pile. So yeah. Well,
Yeah, yeah. Yeah, and then it's I think we'll probably hit a place if we haven't hit it already where okay, now we have the education, and how do we start to then weed out what is real versus what is, kind of people jumping on the menopause moment and, the menopause supplements and all those other types of things.
yeah, no, I've definitely seen a lot of that. I'm like, oh no, now we're gonna market this whole
Yeah.
thing out of,
Yeah.
people out of their money and use fear in all the wrong ways. So what would your suggestion be to someone out there who's getting all these random things popping up in their feeds? Like is there a place or places you would recommend? I mean, obviously there's your feed, your Instagram, which I'll put in the show notes, but what are some places you would suggest people go to like get good information?
Yeah. I find that the International Society for the Study of Women's Sexual Health, ISWISH, is at the forefront of these kind of conversations. It's an organization made up of MDs, NPs, physical therapists, sex therapists, mental health providers. So it's interdisciplinary. And they're having a lot of the conversations 5 to 10 years before anybody else catches up with it. So they're a great organization to watch. They have a list of providers who are members. That's a good sign. If someone is spending their own money to be a member of this organization, they're probably going to be more able to support you and more willing to get creative with solutions.
Right. Great. Well, that's great. I don't think I've ever heard of that. So,
Mhm.
like, I've heard of Menopause Society,
Hmm.
but I
Hmm.
had not heard of that one. So that's really great. Thank you.
Yeah,
I'm gonna check that out.
you should.
Like, oh, I need to go see what's happening over there. Um, so what would be some suggestions you have? Because so you practice in Texas. You're in the larger Dallas metro area,
Mhm.
right? So
Yeah.
you see women there in person, and then you said you do telehealth throughout Texas. Any other states that people may be in that they could do telehealth with you?
Yeah, yeah, we have a wait list open to start seeing people in Oklahoma, Kansas, and Minnesota, and that
Mhm.
may expand in the future. But yeah, if I'm not available, there are great clinicians. I'm connected to many of them throughout the US. And I think that's something that people need to hear too. Like, Yeah, there's a lot that's not good about the system. There are unfortunately many clinicians who don't listen, and there's a growing wave of people who do want to.
Right. So, in terms of where you are now with your practice, and what's the next evolution of that for you, or is it sort of just like continue? I mean, like you said, you're very active on social media, which is fantastic. I always love seeing your stuff there. But what do you feel like is the next place you want to take your practice?
Yeah. So the vision, the dream in the next 5 years is to grow the team. We have more patients than we know what to do with right now, which is beautiful. But we I need support, so adding some wonderful clinicians to the team. And for me, really digging in and exploring how to support people with endo and these other related conditions that I was talking about, the mast cell, the neurodivergence, the hypermobility, especially as they walk through perimenopause. Because even if endo is recognized and diagnosed, which usually it is not, but say it is, many times those patients are then told that they cannot receive hormone therapy. And so then they suffer even more as they go through perimenopause and menopause. So for me personally, I have a lot of passion projects in the works, trying to educate more practitioners about how to treat endo, and hopefully even get into some research on how we can start to um, make good endo care more accessible in the mainstream system too.
Well, that's why I'm really grateful that you do the work that you do the way that you do it, and that you're just very online about it. And how do you navigate that, like being online, on social media, making content there, in the middle of? I mean, I know it's hard for me, and this is my main thing that I do. So I'm just curious, like, how do you balance that?
Yeah.
You know.
Yeah. Well, thankfully, I have a really, really good help, support, someone that helps me with my social media, that has kind of a bigger view, on things than what I have in like the day to day. And like as far as personally, I think it's challenging to be a practitioner, also have personal stories, and walk the line of not centering myself and also saying, I really do get it. Like, I really have been there, and my story is not the same as yours. And so I think for me, that's the biggest tension of like not centering myself, but also sharing enough of myself so people can trust me, you know?
Right, right. Yeah, that is a delicate balance. I mean, as someone complete aside who's, at some point looking to be a practitioner, not medical, like a somatic mental
Mm-hmm.
health practitioner, I'm aware of that
Mm-hmm.
centering thing and like that fine line.
Hopefully I share enough so people know it's legit without without getting too into the weeds.
Right, right. Awesome. Well, I guess is there, before we get out of here, I was just curious, is there, what would be, if you had to give someone one thing to do or like suggest, like do this one thing, that in one of the things you already mentioned is, do your own little log, do a log, fill these questionnaires out. But in terms of the like, just even the shame or the grief, before you can even think to go look for help, what would be one suggestion that you have for someone?
Yeah. I think hopefully people have at least one friend in their life. I know that's not the reality for everyone, but for me, and like kind of like you said, it wasn't until one of my friends saw how much pain I was in that I got help. And so I think letting yourself be seen by someone outside that can say, hey, that's not normal. I don't experience that. And whatever the symptom is that you're concerned with, so that someone else can validate your experience.
Right. Oh, that's great. Thank you. Yeah. No, I think that's so And equally, I guess I would add to that, for all of us to pay attention to each other, right? And like
Yeah.
notice, like, hey, that doesn't seem okay. And it's okay for me to say, or at least ask, hey, what's happening here? Yeah.
Hmm.
So letting myself be seen, and then also being willing to risk asking a question of someone else that I might see something in. Yeah.
Yeah. Yeah. Yeah.
Well, thank you, Lillian. It's been really wonderful being able to chat with you.
Yes,
And
it's been great. So,
hopefully next time I'm out west and in Dallas again, which I'm sure I'll be at some point, I can come visit and see the clinic
yeah,
in
come see the
person.
space. Yeah, come and have some coffee and check it out.
Yeah, I would love that. That would be fantastic. All right. Well, thank you
Thank
again.
you.
Okay. Bye. Thank you for listening to The Stories That Sparkle, a space I created for women to share in their own voices the intricacies of their stories, and also increasingly a space for topics around women's health, mental health, women founders, so all kinds of different versions of what story means. So this space is big enough, I believe, to hold all of the above and then some, things I don't even know yet. So I'm really excited to keep building this space. Thank you to Lillian. Thank you for joining me. And yeah, wow, what an incredible conversation that was. It was really enlightening to me, even things I didn't know. And I was like, I thought I knew a lot about menopause and menopause symptoms, but who knew? There's always more, it turns out. So yeah, really grateful to have this conversation about endometriosis, pelvic pain, and just the shame and grief that surrounds all of those different health issues. So really grateful to her for joining me. Thank you, thank you, thank you. If you would like to support the work I'm doing, help me get the word out, please. I want to keep building this platform bigger, wider, taller, and create more space for more women and more voices and more stories of all kinds and topics and issues and things, just things, all the things. So please do me a favor and pass it on to 2 friends. Become a subscriber at hellarator.substack.com. Follow me on Instagram at hellarator, or just go check out my website, hellarator.com, and find out all the things about me that you want to know over there. And see how you can get involved. Collab with me. I would love a collab. I'm all about the collab, y'all. And I travel, as you know. So I will go wherever you are and I will collab with you. So please reach out via my website. Most importantly, if you have a story you want to share or a topic you'd like me to cover in an episode of the podcast, or you want to send me a written story, 1,500 words or less, go to my website, hellarator.com. There's a tab at the top called submissions. So submit via one of those 2 forms. And let's get these stories out there, because together we bring light into dark places. I'm Hella Rader. With a good sense of humor, an open heart, and an open mind, I love to explore the very human complexities in others and in myself. That's why I created a space for women you have never heard of and could easily pass on the street to share in their own voices the intricacies of starting over in life, building community, inhabiting their bodies, and more. Welcome to our Disco Ball, the stories that sparkle.